What is the difference between OSHA, infection control, and HIPAA? We get this question all the time. The second part of that question is usually, do we need training on all three? Let's walk through it in a simple way. First, OSHA. It stands for Occupational Safety and Health Administration. OSHA is focused on employee safety. It sets the rules to protect your team from workplace hazards like bloodborne pathogens, sharps injuries, chemical exposures. Now, if you have employees, OSHA applies to you. And yes, OSHA requires training, and that includes initial training and annual updates. Next, we'll look at infection control. It's about protecting your patients and your team from the spread of disease. This includes disinfection and sterilization, instrument processing, hand hygiene, water line safety, and proper use of PPE. Infection control is largely guided by the Centers for Disease Control and Prevention, the CDC, and your state board. While it may not always be labeled as a standalone law like OSHA, it is expected as part of the standard of care. Training is essential here, not just for compliance, but for patient safety. Finally, HIPAA. HIPAA stands for Health Insurance Portability and Accountability Act. HIPAA is focused on protecting patient information. This includes privacy of health information, security of electronic data, and proper communication and access to records. If you handle patient information, which most healthcare offices do, then HIPAA applies to you. And yes, HIPAA training is required for your team. So do you need training on all three? Yes, you do. Each covers a different part of your practice. OSHA is employee safety, infection control is patient and clinical safety, and HIPAA is patient information and privacy. And together, they create a complete compliance system. Here's the part that often gets missed. Your team needs to be trained on all three areas upon hire and annually thereafter. This is where many practices fall short, but it's one of the most important steps to staying compliant and keeping your team and patients safe. Most practices don't struggle because they don't care. They struggle because the information feels overwhelming or unclear. When these areas are broken down and implemented correctly, compliance becomes much more manageable and your team feels more confident in what they're doing every day. I'm Kelly with Healthcare Compliance Associates. Smarter systems, safer teams, stronger practices. Subscribe so you can stay ahead of compliance requirements.